Thank you, Adrienne. As she just mentioned, wildfire smoke and poor air quality can affect anyone, but some people are at greater risk than others. Right now, we're seeing unhealthy levels, and these conditions are expected to linger across Idaho. We're talking about who's most at risk, how to stay safe, and when to seek medical care. We are joined now by Dr. Wesley Pidcock. Thank you so much for joining us.
Thank you for having me.
Tell us a little bit more about what this air quality can do to anyone.
Well, really the key thing to keep in mind is what group do you fall into. If you're fall into one of the sensitive categories, which is really children, the elderly, and anybody that has any kind of underlying lung or heart problem, at that point you're much more sensitive and you have to pay attention to a lower AQI level, meaning that all these recommendations in terms of avoiding being outside, wearing a fitted mask, that really kicks in for you at an AQI above 100. And if you're not one of those people, you really got to start paying attention to it around 150.
Interesting. When it comes to people running outside and maybe if they're healthy, should they be concerned about something like this, how things stand out right now?
Yes, I would. I personally don't have any medical problems, and I love exercising in the outdoor. I think that's part of the reason most of us live here. But when the air quality is in the 150s, 200s like it's been lately, I don't do that at all, just because there are health risks that can be associated with that.
What are some of the symptoms that people should be looking out if maybe the air quality is affecting them?
The biggest things you can start seeing is things like itchy eyes, you can feel like a scratchy throat, all the way to shortness of breath, wheezing, cough, headache. Those are the big ones to pay attention to.
Are masks very important to use right now? Do they actually work?
Yes, it depends on which one you're using. Okay. If you use like a simple surgical mask, the kinds that are loose fitting and loop around your ears, those don't work here. Those are designed to catch large droplets that are either coming out of your mouth or coming from someone else's mouth. In this scenario, we're really looking at those fine particulates that are in the air. You need a fitting mask like an N95.
How can you protect? Maybe you are in the in the healthy category there, but if you have family members who could be at risk, how can you help protect your family members or friends in general?
The key is if you fall into one of those groups, particularly if you have like what I see a lot of people that have poor lung function, is to make sure you have enough of your medications on hand, so that being like extra inhalers, and then also creating a clean room within your house. So this can be like a room that preferably doesn't have any access to like the exterior of the house, and then also putting an air filter in there. These can be purchased online for, $250 or so. Not everybody can afford that. If that's the scenario you fall into, I would recommend that you look up something called a Corsi fan, which is something that you can build on your own that does the same thing as these filters, or these more expensive filters, but they only cost about $30 to build.
You talked a little bit about the symptoms. When should people know when to go to the doctor?
I would say that one of the key things I just want to make sure we emphasize is making sure that you're paying attention to that AQI so you don't develop those symptoms. But if you do happen to start developing, the trigger that I tell my patients to getting a hold of the doctor is shortness of breath, wheezing, or extreme coughing.
What does that look like, getting medical treatment at that point?
Depends on the underlying problem. If you call your doctor, they can help direct you which direction that would be. Some of it can be done over the phone with additional medications, but the key of calling them is to figure out where that should be done, and sometimes it has to actually be done in like an inpatient facility.
All right, well, thank you so much for joining us. This is important information, especially as our air quality stands now. We'll be right back after this quick break.